What does a rhinoplasty surgeon see when they look at your nose? Hi, I'm board certified facial plastic surgeon, Dr. Delaney. And here's a good example of what I'm starting to picture in my mind when I see a patient for a rhinoplasty consult. Of course, we'll look at the nose, we'll feel the nose, and we start getting a good idea of what the structures underneath would look like. So we'll work our way from top to bottom. So all the way here at the top, these are the nasal bones. They're actually quite thin. They range anywhere from 2 to 4 millimeters. So that's why they're really easy to fracture as well. So when we do bony work to the nasal bones, we work on the nasal bones truly, but also the maxilla. You can see on the side here, here's a suture, and this is actually our maxilla off to the side. So we'll actually be working with some of the maxilla as well during rhinoplasty. And then next structure is this red structure you hear that runs kind of along the middle. That is actually the top of your septum. The same septum that you have on the inside, the top of the septum provides support to the lower 2/3 of the nose. So it's really important. And then so, as you can imagine, if you have a deviated septum, the septum's crooked, that'll be shown on the outside as well. So if I see someone who has a crooked nose, I could say pretty confidently that they probably have a deviated septum as well. And then so next on the side of that septum, this green structure here, that's called the upper lateral cartilage. So you have, it's a pair structure, one on each side, and then that provides some rigidity to the nose, but not so much that the nose is really hard. And so this allows the nose to be compressible, to move around a little bit. And then so for people who have trouble breathing, where when they breathe in, the nostrils collapse, we sometimes want to look at the upper lateral cartilages to see if they need some support. We may do some grafting to improve the strength of those areas. This structure down here is called the lower lateral cartilage. It's a curved structure that comes up this way and out this way, and you have it on each side. So the size, shape, and configuration of the lower lateral cartilages determine the shape and position of your tip, essentially. And then the area where that green structure, the upper lateral cartilage, and the lower lateral cartilage come together is called the scroll. And the reason for that is in some patients, they actually curl around each other, literally like a scroll. And so in this demonstration here, obviously, it's just showing they're abutting each other, but you can see all sorts of different configurations in different patients. And then so this area right here where the upper and lower lateral cartilage joins is really critical, because this is also an area that's called the internal nasal valve. And then so this is the most crucial area for nasal breathing, because it's the most narrow area for your nose. And then so if you have collapse here, that's something we would look at and see if we could correct with surgery. And then lastly out here, you can see you have this yellow-like structure. So the nostril here is actually mostly fibrofatty tissue mixed in with some floating pieces of cartilage seen here in pink. So if you get a cut here, you're actually not involving your cartilage. Your cartilage is more this area. So out here, this is just fibrofatty tissue. So hopefully this is helpful to kind of give you a sneak peek into what I, as a facial plastic surgeon, think of when I look at noses.